Welcome to the first episode of Let's Talk Health and Care podcast series brought to you by the Integrated Care Academy at UWE Bristol. We'll be diving deep into exciting research and service changes by speaking to the people directly behind them. I'm Peter Brindle. I'm a GP with a real passion for service improvement, health tech and innovation.
And I'm Mark Griffiths, Pro Vice Chancellor and sponsor for the Integrated Care Academy at UWE Bristol. Welcome to Let's Talk Health and Care.
So Mark, why don't we start by you giving our listeners an overview of what the Integrated Care Academy really is and why was it established?
So I guess, Peter, the Integrated Care Academy, or ICA for short, at UWE Bristol is all about improving health and social care for our local communities. The ICA at UWE Bristol is obviously an umbrella across the entire organisation. It involves so many people across different disciplines, be it health, social care, engineering, built environment, law, ethics, etc. Such a vast number of people who have the subject expertise to make a big difference. It's also, though, about how we train the workforce for tomorrow, health and social care, doing impactful research and really lean into those challenges within society that are persistent, and working across diverse groups, local authorities, communities that really matter. I guess this is about how we can make a difference to society, working in collaboration. So I'm delighted that this has come around, because actually this is about how we take learning as a university and bring that into different communities.
I really like that rekindling of the Nightingale COVID experience that I remember well. And it was a really difficult time, and thankfully it's in the rear view mirror now. But we do know that the population and the workforce are still bearing some of the scars, aren't they, from the whole COVID experience. What do you think the kind of major challenges are now that are being faced by health and care systems? Perhaps things that already existed before COVID, but are perhaps made even worse because of COVID?
Yeah, that's a really great question to ask. And I guess the backstory to the development of the ICA at UWE Bristol was born out of the COVID-19 pandemic, and that ways of working beyond boundaries, beyond silos, and without some of the, dare I say, bureaucracy of what can sometimes slow you down. Some of the health determinants, particularly amongst diverse communities, particularly the global majority communities during the pandemic, which we saw. It's those sorts of areas, those health indeterminants. So making a workforce that is culturally aware, is understanding of the difference that exists, particularly in a multicultural city like Bristol and the region, but also some of the innovation that came from it in terms of how different colleagues across different subjects, particularly the health sciences, life sciences and healthcare, came together to provide innovative solutions. I think some of those challenges still exist, particularly workforce. You know, there's real pockets of workforce challenges that exist, and we're not alone across the southwest as a region. That this is where we really lean into those spaces, though, and try and work together to understand what's the art of possible going forward in terms of how might we shape those workforce types of the future, and what might that look like, involving our further education colleges, our diverse communities, to make that strong pipeline.
Yeah, so if we are looking forward to, now's a great opportunity for you to share some of the initiatives and projects that the ICA has actually started to do.
Sure. One of our key projects that springs to mind that I think most days I'm reminded of, I think as a health professional myself, like yourself, Peter, is the one around how the positive impact we've managed to create for Black and Asian biomedicine students in the region. We managed to get some funding for this from NHS England as part of the initial work for the ICA at UWE Bristol. And this was something that really, I think, spoke to me, both as a leader, as someone who's begun to understand some of the challenges for some of our diverse groups. And this was about ultimately providing equity of opportunity for access to an internship prior to getting employment within the biomedicine field. And what became apparent from working with colleagues in this space was particularly for Black students, this was an opportunity that was sometimes not taken up because of pressures of having to work and other family or wider commitments compared to, for example, white students. So through some funding and an initiative, we managed to basically get paid internships for a number of Black students who were then able to report back on how I guess life-changing that had been for them in terms of giving that opportunity and access to what that meant as a stepping stone to getting their first job. The upshot of this, and it's important that we talk about impact here, the upshot of this is that both employers and those graduates who happen to be black have basically had a greater chance of success when they get their first graduate job within practice. Another area, the upskilling of sonographers. So sonographers, those that undertake ultrasound in practice, being able to upskill them and provide enhanced practice skills in the space of hepatobiliary imaging, for example, and biopsies, has meant a transformation of patient flow, which again is one of the key themes of the ICA at UWE Bristol as well. Both of these projects are funded through NHS England South West and within the ICA, what we call Observatory. And I would like to just pause for a moment on that key word observatory, because to some people, the word observatory might sound a bit odd. But actually, when we came up with that word, we really wanted to try and position it as something that an observatory, sometimes people might look through to the sky, see into the future, look what's around them, future gaze. And we saw this as being a space really where the testing, the development of ideas, and the fruition and the impact that creates through collaboration is, what it's all about in a safe and controlled way. Because if I go back to both those examples that I gave you, I think both of them, doing it right, meant that there was impact for those concerned.
I just love a bit of future gazing, especially when I can use it to save myself some time. So as a GP, time is always at a premium, and anything that helps me save a bit of time so I can spend it more effectively with my patients is good. So I just had an amazing experience a few months ago where I tested out a piece of software that could listen to a consultation, transcribe it, and then turn it into a really, really well-edited, precise summary of the consultation that could go straight into the record. And it absolutely blew me away, because one of the most boring things about being a GP is you have to write loads of notes. And sometimes I spend longer writing notes than I do actually talking to the patient. And either I can do it with them in front of me, in which case I'm not actually talking to them, I'm tapping away, or I do it afterwards when they've gone, and then I might forget some stuff. So this platform absolutely blew me away. Amazingly, I start here a while ago and I see that our primary care lab, part of the ICA, is doing exactly that. It's testing some of the products that are available that will help practices and hospital care save time in their consultations. So that's one of the things the primary care lab are doing. So that's the tech side. Mark, I think you come from a radiography background, don't you?
Yes, yeah.
So what are your thoughts about future gazing and tech within imaging? Any thoughts there?
Oh, blimey, where do I start with this, Peter? Yes, you're right. I come from a diagnostic radiography background, and I know when I was training many, many moons ago, and what's happened since, and with the advent of AI, so artificial intelligence, automation in practice, and the flow of how that works within a kind of imaging environment, it's radically changed, I think, the environment for those working within it. I think for me, though, and this is where perhaps my wider interest in the whole human tech interface in terms of what happens to the people involved and how do you maintain those human factors, patient care, things like critical evaluation and advanced practice. It's really important to map out and I think understand where things like AI or digital enhancement can really help and where it can embrace patient care. There's a danger that it becomes something that takes over the kind of journey for that patient and the human involved becomes secondary order. That's a risk, and we know with recent publications like Darze's report, which look at the three fields of tilt and particularly the kind of digital innovation required to steer, I think, health and care provision to a different space to where it is currently. That needs to be, I think, more fully understood. And that starts with things such as how you embed this within curricula for educational programs at all levels, all pipeline as well. There's also CPD, so your lifelong learning. And again, I think there's also something that I'm really passionate about is how research and good research done well kind of features within this space that can actually help progress further provision of patient care.
I think it's such an exciting area. We know one of our biggest challenges is people waiting for diagnostics. And part of that challenge is it takes a lot of time, a lot of resource reading these images, reporting them, and then getting them back to be acted on. And, machines can read these things so quickly. And guess in reality, there are some big concerns about safety. So inevitably, you want to make sure that they're actually reading them properly. And that all needs to be teased out so that professionals can gain confidence in new technology. Because it's all very well developing technology, but if it's not adopted through people's important professional concerns, then it's never going to be used. So testing it in a rigorous environment, the sort of environment the universities and things can provide, I think is really important.
Yeah, I mean, just to add to that, I think you're absolutely right, Peter, and that's where simulated learning, which forms a massive part of curricula, and not just in healthcare. There's many in our sectors, such as engineering, for example, where we have either virtual reality, we have high fidelity mannequins that can blink, they can cry, they can speak. These are all really important kind of spaces where our students and staff can really develop new ways of learning and assessment that creates that safety net for them, which is really important, and again speaks to where the Integrated Care Academy is trying to kind of, I think, understand better what can we do more of to make sure we're making competent, safe practitioners out there in the big world.
I certainly remember when I was a medical student, I really wished I had a chance to do a bit of simulated learning before I actually practiced on real patients. I don't think any came to too much harm, but it was a pretty stressful experience trying to minimise that. So, I guess if I was going to summarise the ICA in a sentence, I think what I'm hearing is it's something like it's a collaborative that's aiming to tackle really big health and care challenges by helping to create that workforce of the future, that kind of digitally enabled workforce with the right kind of attitudes and skills. What do you think, Mark, are these right sort of attitudes and skills that this workforce are going to need over the next 5-10 years and beyond? What do you think?
Oh, Peter, I think the whole skills agenda, and that's not just skills as we know it as a traditional word. There are many great skills in existence, I think, across the health and care environments. Many, fantastic practitioners out there doing the very best and pushing the boundaries, I think, of practice. I think what struck me with your question then was around where did the COVID-19 pandemic, and I know it's perhaps a bit not the best to be going back to that time, which everyone remembers, but actually the innovation that came out from that time is important to remember. Many innovative ways of working. Look at the NHS app, for example, and now how that's suddenly come to life since the pandemic.
Let's not forget never-ending Teams meetings.
Never-ending Teams
meetings. Where would we be without them?
I think the acceleration of skills, the drive towards creating the conditions for embedding an innovation-first approach, and I've seen this loads through the curricula in many education programs. I've seen this now in the design, the delivery, the assessment of patient pathways. I've seen this through the ways in which teams come together, and I'm talking about physical teams. There's areas such as digital literacy, electronic patient records, telemedicine, remote monitoring, and you mentioned earlier the primary care lab, which I'm sure we'll come back to talk about that in a future podcast episode. There's also something about the analytical skills and our ability, I think, in this sector to take from other industries and actually embrace and adopt new technology. And what's that mean for the patient and their families? What does it mean in different settings, be it acute, the hospital, or community settings, or primary care? And again, the drive to that primary care model of doing what we can within the home, doing what we can within a patient's own environment for a number of reasons is really, really important. So that requires a different mindset and skills as well. The last thing I'd say is about, and this might be an obvious thing, is that culture of compassionate and diverse leadership. I think this relates to many areas of health and social care, and let's not forget that, because sometimes, as we've both talked about in the past, Peter, social care can become neglected when the conversation's happening. So it's really important to bring it into the forefront of what we're talking about. And I'm sure we'll be covering lots of these areas in future episodes of this podcast series.
We will indeed. We will indeed. So the ICA is just really getting going, isn't it? So what do you think some of the future plans are that the ICA is going to be cracking on with soon?
It is just getting started, and I think this podcast series is probably several months in the making, if I'm honest with you. It's not as easy as it looks, is it, in terms of the setup, the thought, the consideration. I think others make it look, quite slick and straightforward. So you're absolutely right. It's a movement. It's something which the origins do come from the COVID-19 pandemic, of how universities played a part in the civic responsibility to the response to COVID. I think one of the first and foremost steps that has to happen through kind of strong leadership, and this is where the Vice-Chancellor, Professor Sir Steve West, has had a really active, passionate role in leading the charge on this, is building that collaboration to ensure that we focus on the issues that matter to health and care systems. I think there's an opportunity to really solidify and agree on the short and medium term objectives. It'd be wrong for us to really set in stone those objectives without making sure we've got stakeholder involvement. What matters to society? What are the challenges, and where are the opportunities possibly to find solutions? And sometimes, do you know what? Sometimes it might not be us that finds those solutions, but it might be our ability to guide on a path those to create those solutions. And the best form, I think, of health and social care is those that can help themselves and have a preventative approach towards their health and care needs. But it'd be remissive of me to not mention things like the diverse communities, the schools, the colleges, the outreach work, and how we really work with diverse partners going forward to understand what matters to this part of the country.
I think it's just so important that we remain kind of laser focused on the challenges, so that we are really focused on these challenges, developing the solutions towards them, and making sure that we do create that workforce of the future. And it's that collaboration. In isolation, we may think we know what the big issues are. We may be right, we may not be, but it's working with others to identify them, and then galvanizing all the energy of our communities, of our industry, academia, to fix them. So for me, that's exciting. Mission focus on those challenges. So we're beginning to wrap up now, I guess, Mark. We could keep on going forever.
We could.
We don't want to be losing our audience before we've started. So how can listeners get involved or learn more about the ICA?
I think it's about the medium of how we get the ICA across to different communities. So colleagues and listeners can visit our dedicated web page. So if you do a search simply in your favourite search engine for Integrated Care Academy at UWE Bristol, or even just Integrated Care Academy, it will appear, and there will be a link to it. On that web page, you will find more information on the ICA. You'll also find some examples of some real-world case studies that have been completed through funding, and again, they're really worth a look at, because it tells you the people involved, the impact, and just what happened in those spaces and for whom. And I think that's again the really powerful message of the ICA at UWE Bristol. We've also got a link that will be on the main webpage to SoundCloud that will host this episode, obviously, where people have found it. But also the future episodes will be on SoundCloud as well. And the name of that podcast series, as mentioned at the beginning, is Let's Talk Health and Care. I think that speaks to what the ICA at UWE Bristol is all about, really. So there's multiple ways in which people can access. And yeah, I guess, if this is something that kind of appeals to you and you'd like to get involved, we'd also love to hear from you as well. But we'll say more about that in a moment.
Great. So thanks so much, Mark. It's been such a really interesting introduction to the ICA. It sounds like we're very much at the beginning of a very, very exciting collaborative effort where the whole is going to be just so much greater than the sum of its parts. And to our listeners, thank you so much for joining in. Remember, this is the first of what we hope will be very many podcasts where we're joined by guests who will be part of many of the different exciting adventures that we'll be having within the ICA. And we want to understand not just the work and the research and the services that are being done through the ICA. We want to understand the people behind them, understand what drives them, what's got them into trying to tackle these particular areas, because so often it's the people that make the research meaningful and interesting, and that's what we really want to get under the skin with. So in our upcoming episodes, we'll be going into a lot more deeper areas, and we'll be starting off with our next one with Nor Nixon, and Anthony Hill, who'll be telling us about their work supporting the healthcare students from diverse backgrounds through the inclusive training and practice work. Now, by a very happy coincidence, we were both at the kind of a launch event yesterday. Yeah. In fact, I was at it, you were leading it, you gave a very great speech, Mark, at the very beginning, got it all going. I was very impressed by it, but I'm really interested to know, what was the kind of highlight, do you think, from hearing about the work that Nora and Anthony have been leading?
The many highlights. And for me, just sitting there and seeing, the turnout, which was phenomenal from different organisations across the Southwest. I think it was the bringing together of the people who have contributed to the creation of the learning resources. When we saw who was up there on stage, there were several colleagues from across diverse organisations, and how they've been brought together, and that's testament to Nor Nixon, who you mentioned earlier. Bringing those people together doesn't happen by chance. That's through hard work, that's through connections, that's through an understanding the need. For me, that was the standout moment, and I think just the richness of those resources, without giving away any spoiler alerts here, I think that's the richness of for me, was the biggest take home, and just the way in which it's been approached.
The calibre of those guys that have pulled together the resources, I thought, Nor, where did you find these people? They are absolutely amazing. One by one, they gave a 3-minute pitch about themselves. Each of them gave a personal story. And I thought, that is high caliber staff, that is. And then they go and demonstrate some of the resources, and you think, they produce some cracking stuff. I guess what really struck me were the personal stories again, particularly those two who were the contributors. One was a healthcare member of staff and one was a student. And they gave some very powerful stories about their experience as international students and staff, some of the language and cultural issues that they struggled with and have been helped with. So personal stories, very powerful, always bring it home, and those are the things that you tend to remember, aren't they?
Oh, absolutely. And if that doesn't kind of tantalise our audience for the next episode, I don't know what does.
We've done a pretty good sales pitch for that one, haven't we? And I don't think listeners are going to be let down. Right, so I think that's it. So do please contact us if you've got any questions at all about what we've been talking about today, anything to do with the ICA or the podcast series. If you've got any ideas for the podcast, do let us know. You might want to be a guest yourself, who knows? We're really pretty easy to get hold of. Just look us up on LinkedIn. We will be getting an email address for the pod series, but we don't have that yet. So in the meantime, just find us on LinkedIn. We're pretty easy to spot. I think that's it for now. A big goodbye from me, Peter Brindle.
And a goodbye from me, Mark Griffiths.
Goodbye.